and welcome to another edition of Feel This Pain. I'm Ken McKim, and tonight we're going to be talking a little bit about something known as Postural Orthostatic Tachycardia Syndrome, or POTS, or POTS.
So what happens in a normal person is when you stand up, a lot of blood rushes down to your legs, your lower legs, your feet, and that's usually not a problem because for most people their vasculature will constrict and then force blood to go back up into their upper torso and into their brain. But with someone who has POTS, those blood vessels don't constrict, and so most of the blood continues to linger in the lower torso, which means that you don't get enough blood to your brain, which can cause things like dizziness, lightheadedness, or even passing out completely.
Now, POTS is a disorder of the autonomic nervous system. That's the system that controls things you don't think about, like breathing, blinking, your heart beating, all that kind of stuff. What can cause POTS? Well, a virus, physical trauma, Lyme disease. Heck, some people report that gastric bypass surgery caused it for them. So again, women get this more frequently than men. It's a ratio of 5 to 1, and you usually see it in the ages between 12 and 50 years old. Now, if you see any of these symptoms on this chalkboard here and you've had them for at least 6 months, you might want to talk to your doctor about POTS. However, since these symptoms could indicate any number of conditions, it can be hard to get a diagnosis. So what do doctors look for? Well, they look for an increased heart rate. Anything that's a rapid increase of more than 30 beats per minute, or a heart rate that is exceeding 120 beats per minute within 10 minutes of standing up is probably POTS. This is what separates it from just being dizzy or lightheaded when you stand up. As far as medications, you have fluorocortisone as well as midodrine, both of which increase blood volume and narrow the blood vessels, which helps.
Now, some people have reported great success by doing nothing else except increasing the amount of sodium in their diet, which of course flies in the face of everything we've heard over the last 10 years about how you're supposed to decrease the sodium in your diet. But for some people with POTS, that works wonderfully, even better than medication. So what does it feel like? Well, as we previously discussed, it feels like when you stand up too fast, except for people with POTS, it happens just about every time they stand up, not just twice a year like for the rest of us. And there's a lot of fatigue associated with it because remember we talked about that increase in heart rate. So if you manage to sit up in bed and not pass out, and then you manage to get up from a seated position and not pass out and make it to the bathroom so you can use the restroom and not pass out, you are going to have to lay down on the floor to recover because you feel like you just sprinted a 5K. And all you did was go from the bedroom to the bathroom. Can you imagine what it's like to try to live a normal life with that level of fatigue? It's crazy. Can you imagine how scary it is to take a shower not knowing if you're going to pass out in the middle of it and split your head open on the tub? This isn't just a little lightheadedness. This isn't just being a little faint. POTS is serious, and it has serious implications to the lives of the people who deal with it on a daily basis. So, if you know anyone who has POTS, 1, try to learn a little bit about their condition so that you can speak with them intelligently about it, and 2, of course, give them all the support, sympathy, compassion, and respect that they deserve because they're dealing with a lot. They didn't ask for this, but they're living with it. And you should be a compassionate person anyway, right? Right? Of course you should. That's all the time we have for this week. As always, if you have any questions for me, you can send them to me, ken@don'tpunishpain.com. You can also follow me over on Twitter @don'tpunishpain. That's all the time we have, so I'll let you go. But until next time, as always, I'm Ken McKim. You take care.